Hello dear friends, my name is Dr. Igor Atabekov. I'm a clinical oncologist practicing since 2010. Today we're continuing our playlist in different poisonous plants and how to use them in folk medicine, and even there will be some information about official medicine and about oncology. So let's get started. So today's topic is RIP. It's not rest in peace, it's ribosome-inactivating proteins. But also they are toxic, that's why they can cause this one. How do they work? These proteins can block the action of ribosomes. Ribosomes are the protein factories in our cells. If protein is not produced, the cells will be dysfunctional and they will die. Here we see a big article with different mechanisms, how the protein, which are found in many poisonous plants, can attack the tumors. If you are interested, please watch it. So we know that RIPs, they are used in, these plants containing RIPs are used in traditional folk medicine of many countries for centuries. This is okra, the first one, also called bamia. Again, toxins are different, concentrations are different. Some food that we usually eat, it contains toxins, but mostly it's very low amounts or not very poisonous, or it's degraded while cooking. That's why it's not a big deal. But there will be some plants which are very poisonous and dangerous if you ingest them or inhale them or touch them or, I don't know, do something with them. In preclinical studies on cancer cells, on animals, it really showed a good anti-cancer effect, but they used their extract of this toxin. In reality, you cannot get a lot of toxin if you just eat okra, if you want to use it against cancer, because you need to achieve good concentrations inside the tumor. But in general, in folk medicine, it's used for cancer, diabetes, gastrointestinal diseases and infections of urinary tract. Next one. This one is abrus. It is also called rosary pea. It is very poisonous. It is dangerous. It is used for many conditions in the folk medicine in very low concentrations. For example, for pruritus, itching, analgesic against pain, for cancer, diabetes, etc. This one is corn cockle. It has toxin gitaggene, which is dangerous even for huge animals, for example, horses. This plant can grow in the fields, and the horses, the cows, may eat it and be really intoxicated, even die. It is poisonous for heart, for neural system. It can cause the destruction of red blood cells. And this is amaranth, that is usually used as diuretic or laxative. This is Aurelia elata, the fast-growing tree. Also has toxins, arelin, used usually for GI diseases. And this is asparagus. Usually we eat sprouts, and these fruits are toxic. In folk medicine, it's used for joint pain, for diabetes, for urinary problems, for kidney problems. And these are beetroots, used for inflammation. As a diuretic, it's a laxative. By the way, there is extract from the beetroot leaves that has a good effect in improving the bile outflow. This is Henapodium album, which has the toxin ascaridol. Ascaridol, yes, it is used to treat parasites in folk medicine. It has laxative effect, and if you take it for long, it can damage the neural system. This is camphor wood, used for different pain and inflammation, used for colds, for nervousness. This is colocynth, a lot of effects also. This is purging croton, you can understand it's used as a laxative, and also for intestinal inflammation and peptic ulcer. Gypsophila, that is used for immune and liver problems, and often used to make the beautiful bouquets for the women. Barley has toxin, but all the effects are not due to toxin, and it's easily degraded during cooking, so don't worry too much. It has a lot of good effects, as you see. Good for blood vessels, for diabetes, for high uric acid, for urinary problems, for gynecological diseases. Rice also for GI problems and for wound healing. Then ginseng, we know it's a good tonic. It helps with impotence or with shortness of breath, with low appetite. This thing is not only very beautiful, but also helps with edema and swelling. Just usual peas. You can see a lot of effects here. And this one is very toxic and dangerous. It is #1 toxic plant in the world in the Guinness Record Book. These are its seeds. They look like ticks, and they make castor oil to stimulate your guts to treat constipation. But don't use it more than 3 days, because afterwards their guts may be tired and stop working. This plant has ricin. Ricin is a very potent toxin. 4 seeds are needed to kill the baby and 8 seeds to kill adults. And it's very unstable. It can easily be degraded by, for example, heating it up. That's why castor oil is not dangerous. Ricin, the toxin of this plant, can cause really bad stomachache, vomiting, their diarrhea, even with blood, their bleeding into the eyes, high fever, seizures, coma, and death in approximately 1 week. This is dwarf elder, used against allergies, against dermatitis, against joint problem, inflammation. You remember Harry Potter had a wand made from dwarf elder. This is saponaria or soapwort, also toxic. It has saponin, it's a toxin, and ricin, previous toxin, and saponin. They were actually used in clinical trials. 10 years ago, that was a trend to use these toxins against cancer. But these are toxins. How do we make the tumor poisoned but the body not? We can add special antibodies. For example, we take the patient with B cell lymphoma and we do antibodies against B cells. And these antibodies will go to the body and find B cells and attach to them. And to these antibodies we can also attach, for example, ricin or saponin that will come, they will be attached to the tumor cell, and then the toxin will act on this tumor cell. Idea is very great. And 15 patients with a B-cell lymphoma who got a lot of treatment already and nothing is helping, they're still progressing, they have no choice of treatment anymore. They were in this clinical trial with quite promising effects. Up to 4 from 10 people, they had a decrease of tumors. But also we know that there is the adverse reaction. The problem is ricin with antibody. It can cause the capillary leak syndrome. That means the proteins are going from blood to the tissues and cause a lot of swelling. The liquids goes also swelling all over the body, swelling, the edema in the lungs, low blood pressure, so it's quite dangerous. But we know that if we use the saponin, not ricin, then we don't have these side effects. And really there were promising results with Hodgkin's lymphoma. From 4 patients, also with the lymphoma that nothing helps against it. 1 patient had total disappearance of the disease. 2 patients had several times decrease of the size of the disease, and 1 had no response. Unfortunately, this kind of therapy can cause immunogenicity, meaning that the body won't like to be injected many times with the foreign substance, and it will make antibodies against this complex, and finally it will learn to neutralize it very fast, so it won't work anymore. And unfortunately this trend passed, and now I don't see a lot of signs about these types of treatment. Now, spinach also has some toxins. It has oxalates also. Be careful if you have kidney stones. And this is mistletoe, very highly promising natural remedy. There are a lot of clinical trials on patients using mistletoe. For example, here it says that you can really achieve improvement of treatment of pancreatic cancer, gastrointestinal, gynecological, lung cancers. And here we see it's a meta-analysis that it really can improve fatigue and physical activity in cancer patients. Here we see that it can decrease the chance of relapse of bladder cancer in the patient who had one surgery, the bladder cancer was removed, it grows again, removed again, grows again, and if they get amela or if they get mistletoe, it will decrease those risks of relapse. This is a patient with pancreatic cancer who had metastases, who had surgery first. Not ever all the tumor was removed. Then he had metastases. Then this metastasis was destroyed with radiofrequency ablation. Then he had metastasis in liver again. It was destroyed again. And then he got mistletoe infusions, and next 9 months, more than 3 years already, he's living, he's working, he is disease free. This is very impressive for pancreatic cancer. And this one, liver cancer, also very deadly disease. Not all our treatment is not very effective, but here we see the patient who did not get any treatment because he was already very weak, he could not survive any treatment, and he got only intravenous mistletoe, and soon all the tumor was gone, and already for 5 years he's living normal life and he is disease free. These are other cases with the use of mistletoe in oncology. Also, there is a case of kidney cancer with multiple metastases into the lungs. They removed kidney with the cancer, but the metastases were there, and usually such patients they don't live very long. But here also mistletoe, and the patient is living for 18 years already without any disease. Next one, stage 4 ovarian cancer. The same, patient is living for 20 years after diagnosis, just getting this treatment with mistletoe. I must tell you that mistletoe was not taken by orally, not in the tinctures, but it was received intravenously or subcutaneously with a gradual increase of dosages. Mistletoe is not a drug. That's why we don't have a full drug information, official drug information, but we know that there are some contraindications like pregnancy, breastfeeding, like liver or kidney failure, intolerance to mistletoe, and also it can worsen their low blood pressure. Dear friends, that's all for today. In the future, I'm planning to do videos about the poisonous hemlock, about aconitum, about artemisia. We know this is a famous antihelmintic remedy, but also theoretically it can help in cancer, and about other potentially effective drugs in cancer. That's all for today. Wish you good health. God bless you. Bye-bye.